Will a vampire facelift affect the skin above my lips? I am sure I need to have a vampire facelift, but I am afraid of its effects on my lips or somewhere close to the procedure area. Please help me.
Thank you for your question. You submitted a question with a photo, and you stated in your question that you are sure that you need a vampire facelift, but you have a concern about the effect of the treatment on the skin above your lips. Well, I think this is certainly a very good opportunity to understand the definition of what is specifically a vampire facelift. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've been a long-standing member of the Vampire Facelift network of physicians. In fact, I have been a resource for the media periodically when there was a need for clarification and understanding about the very popular vampire facelift procedure. So to begin with, I think it's very important to understand what is the specific definition. And to understand that, we go back to the inventor. The inventor was Dr. Charles Runels, who came up with this concept many years ago of an approach to rejuvenating the face, balancing the benefits of a specific filler in the category of a hyaluronic acid filler, such as Restylane or Juvederm, limiting that filler to 1 cc or 1 syringe, and then combining that in its overall rejuvenation effort of the skin with PRP, platelet-rich plasma. PRP is derived from your own blood, and it's a concentration of the wound healing factors necessary to heal your skin, for example, when you get a cut. It stimulates collagen, stimulates blood supply, improves the fatty cell layer under the skin, and gives the skin a very nice glow. So the term facelift may be a little confusing because it's not about vertically lifting the face like in a surgical facelift, but it's a lifting in that the skin is being lifted away from the underlying bone structure, which is one of the major issues of facial aging. Facial aging is typically a combination of volume loss, which is proportionally greater at the bone, fat, skin, and soft tissue, muscle levels, as well as sagging, which is the downward descent. For many of our patients, this vampire facelift procedure is a good fit. Now, it depends on really, with the photo you submitted, what you want to achieve to make sure for yourself that this is the right procedure for you. I'll explain further. First of all, understanding that a vampire facelift, again, is a combination of 1 single syringe of a hyaluronic acid filler placed strategically at different areas of the face, such as the cheek area, the tear trough area, the eyebrow area, even the outer corners of the lips, just basically at the discretion of the physician, placement in specific areas, and then with that, using PRP to globally enhance the skin quality. Now, I have to also emphasize that doctors who are on the Vampire Facelift Network have gone through very specific training to perform the procedure in a way that is consistent and reflective of the standards as established by Dr. Runels. Now, a lot of times people are misinterpreting or intentionally misusing the term to mean just PRP. And the PRP that they're using may not be the same, done in the same way as the way it's used by the doctors in the Vampire Facelift Network. So just to be clear about that. Now, when I look at your photo, I look at a couple of areas that draw my eye. And again, I'm a cosmetic surgeon. I've been doing surgery for over 20 years in private practice. I can pretty much do everything from the minimally invasive, injectables, lasers, to full extensive surgery. When I look at someone like yourself, I look at that the areas that draw my eye are the tear trough areas as well as the cheek area. And I think that in that respect, I would probably suggest for you to consider procedures such as fillers like Restylane to add to the tear trough area. And I would also, for someone like yourself who would come to my practice, I would suggest something like structural volumizing. Now, this is a concept where we're placing a more thick filler, but still in the hyaluronic acid family, such as a Juvederm Ultra Plus or a Juvederm Voluma, at the bone structure level to improve the cheek volume as it relates to the under eye area, to balance and blend that area so that you get a more of a appearance of a lift when actually you've restored volume. Now, in contrast to the vampire facelift procedure, this concept of structural volumizing would require more syringes than the one syringe with the vampire facelift. Now, it doesn't mean that you can't also have PRP done at the same time. Now, going back to your original question about the lip area, it is your choice when you do your consultation with your doctor to discuss where to inject either the hyaluronic acid filler or the PRP. But I think that it's important to understand that it is not absolutely critical to do any injection around the lips as part of the vampire facelift procedure. It's something that there is intrinsically flexibility. When I look at a patient who wants to have injection of PRP, I look at them still more globally and look at the issues. Let's talk about the lips. Are we treating vertical lines around the lips? Are we treating the border of the lips? Are we treating the volume of the lips? Are we trying to give the corners of the lip a little bit of lift? There are other procedures, whether it's the use of Botox, whether it's the use of PRP, as well as other hyaluronic acid fillers, as well as lasers, that can also help rejuvenate the area if that is an area of focus for the patient. So with that understanding, I hope you're able to now move forward with meeting with doctors about the vampire facelift. Now you know the definition and you can understand what specifically may be in your best interest to get the most value out of the procedure you pursue. So I hope that was helpful. I wish you the best of luck and thank you for your question.